everyone, my name is Larissa Ness, Certified Integrative Health Practitioner. I specialize in restoring digestive health and replenishing nutrient deficiencies. I utilize advanced functional medicine lab testing that I offer to my private wellness clients and online through my website to the public, larissaness.com, where people can purchase functional medicine lab testing kits where they can collect samples in the comfort of their own home. And all purchases include a one-on-one Zoom or phone consultation with me where we go over their lab results. And I create a whole personalized wellness plan with diet, lifestyle, and specific supplement recommendations so that you can optimize your health and start feeling better. So today I want to talk about vitamin D. It's so important. Vitamin D impacts over 2,000 different genes in our bodies. It regulates hormones, it builds bone, it supports immune system, our immune system, cholesterol levels, metabolism. It also greatly impacts mood and mental health, facilitates gut healing. That's something that I don't think as many people know about. And since I specialize in gut health, I will oftentimes recommend that my clients also check their vitamin D if they haven't done so recently. It facilitates gut healing and can play a beneficial role in relief from disorders like IBS and symptom improvement in IBD. One study of 90 IBS patients had significantly greater improvement in symptoms of abdominal pain, distension, gas, etc., taking vitamin D as compared to the placebo group. So, vitamin D deficiency, it makes you more susceptible to many things. And I'm going to go through the list here. It makes you more susceptible to weight gain, stubborn weight loss, serious complications from viruses like the one that everybody in our society is really concerned about right now. Poor thyroid function, osteoporosis, even seizures, autoimmune conditions, cardiovascular disease, mental health disorders like depression, dementia, cognitive decline, multiple sclerosis, diabetes, and cancer. So lesser known signs of vitamin D deficiency would be joint pain and stiffness, backaches, muscle cramps, and even tooth decay. You are more likely to be deficient if you are overweight. Vitamin D is stored in fatty tissues, so people with large amounts of body fat they're going to have greater amounts of vitamin D. They're going to need greater amounts of vitamin D to maintain the blood levels similar to those people with lower body weights. So some research does suggest that overweight individuals need about 1.5 times more vitamin D than people with BMIs in the normal, quote unquote, normal range. But as I'm going to talk about in a bit, it can vary person to person, so it's just best to test. You're also more likely to be deficient in vitamin D if you are a senior, and it's important to note that as we age, it becomes more and more difficult for us to synthesize vitamin D. Also, if you have darker skin, just genetically speaking, research has shown that African Americans had to remain in the sun 6 times longer than Caucasians did to get the same amount of vitamin D. You are also more likely to be deficient if you have a VDR gene mutation, which I actually happen to have. So I know that I need to test my vitamin D regularly, and also that I'm just in general going to need a little bit more and have to work a little bit harder to maintain the same status as maybe, somebody else who doesn't have that gene mutation. Ideally, everyone should be checking their vitamin D every 6 months is the best recommendation because it's going to change whether it's in the summer, when we're outside and people are maintaining a tan versus inside all winter, especially, if you work from home, really, really important to be checking your vitamin D. The sweet spot, let's talk about the sweet spot. So research suggests, and it's now pretty well known in the natural health world, of course, that we want to maintain about between 50 and 70 or 50 and 80 nanograms per milliliter. Now, this is something that is not going to be brought to your attention through your normal conventional doctor. So this is why it's important for you to take control of your own health and know what your exact number is, because you might be in the 20s, you might be in the 30s, and your doctor might not bring up that, hey, you're not in the optimal range for disease prevention and to optimize your overall health, and how many things that it impacts if it's below 50. So it's really important for you to know what your number is, and that's going to be my big takeaway, is when you do get your vitamin D check, know what your number is, and so you can take control of your own health. If you do test low and you need to up your dose, then you can retest about 6 to 8 weeks later. I oftentimes don't have my clients retest until about 3 to 4 months later, because we're working on a whole wellness plan, and there's other factors that are involved. You could be deficient in certain things like magnesium, vitamin K, and that could be also impacting gut health. Another thing, I already mentioned that, but if you have chronic gut issues, you definitely want to make sure to address that as well. Keep in mind that high dose supplementation depletes magnesium stores, and so many people are already deficient in magnesium as it is. So this is another one that really needs to be on people's radar. High dose supplementation depletes magnesium and can pull calcium from tissues into the blood. So this could potentially be more harmful if you are really doing high doses here. It's best not to exceed 10,000 IUs per day. Take a D3 form, and always with a multivitamin that has magnesium and vitamin K and other minerals like zinc. Also B6 is important. You want to take, ideally, a liquid form, especially if you're having absorption issues. I work with a lot of people that have digestive issues. So having a liquid, more absorbable form combined with healthy fats is going to be really helpful. And if you get a liquid form, then you just take 4 to 5 drops, depending on what dose is right for you, under your tongue. Super easy. It doesn't taste like anything, at least the brand that I recommend to my clients and people that order lab kits through my website. You don't even know that you're taking it. It's pretty awesome. So best way to get vitamin D is honestly supplementation or sun exposure. It's going to be hard to get what you need through food. It really, really is. I test so many people, and so many people are low in vitamin D. They're just not getting what they need. When you see things like milk and cereals that are fortified with all these vitamins, you're going to see a lot of times D2, which is a synthetic and man-made version, and it has, just in studies, it just does not raise blood levels of vitamin D as well as D3. So you want to be taking vitamin D3. If you're not sure where to start, and maybe you haven't tested or you aren't able to test right now, you can start with 35 IUs per pound of body weight. That's a good, just general overall dose. It's also good for children when you're trying to calculate how much children need by their weight. 35 IUs per pound of body weight. Children often need between about 400 and 800 IUs typically. Just wrapping it up, if you don't spend time outdoors every day, if you work from home, if you're wearing sunscreen all the time, and if you're struggling with any chronic health issue, and this also includes allergies. If you've watched any of my previous videos, or you follow me on Instagram and you see my post, allergies is not normal, and that's a sign that there is an imbalance in nutrients in your body. There could be also, underlying bacterial imbalances in your gut, but there's an imbalance there, and one of those could be that you're low in vitamin D. So definitely, if you have any chronic health issue, check your vitamin D. Thanks so much for joining me, guys. If you would like to test your vitamin D with an at-home lab test kit, look at your other hormones from a functional, optimal level, and dive deeper on your minerals and your other nutrients, looking at your magnesium to your calcium ratio. Those are really, really important to do with somebody who specializes in orthomolecular medicine and naturopathic forms of medicine, somebody like an IHP like myself, or a naturopathic doctor, functional medicine doctor. They are going to be able to look at that from a different lens. You can't just look at those minerals on your standard blood work. That's not something that conventional doctors specialize in. So if you're interested in doing that and you want to do it from your home virtually, I offer it on my website. You can order these kits, and you can do just a simple sample of hair if you're looking at minerals, for example. And the advantage of doing that with the hair is that we're able to see what's happening at a cellular level. Because even things like magnesium through your blood, your body would actually pull magnesium from other tissues so that you can maintain good amounts in your blood. So by the time something gets to an imbalance that shows up in your blood. A lot of times that imbalance has been going on for a long time, and that's why you've been feeling so bad for so long. And even though you went to your normal conventional doctor and you've been checking your standard blood work and everything comes back fine, you're still feeling bad. You're not optimized, right? We use that word a lot. So if you're interested in doing any of that, feel free to DM me or hit me up on my website. You can schedule a free 15-minute consultation if you'd like to learn more about that. Thanks so much for joining me, guys. LarissaNess.com. Check out some of my previous posts and videos. I got lots of free information on my website, on my blog too. Bye.